St Joseph's is one of the oldest hospices in the UK. St Joseph's has been here since 1905 and is celebrating 113 years of service in East London, providing hospice care and specialist palliative care to the poor of East London is very much the mission of the hospice. So hospices, for the most part, are non-NHS. There are a few hospices that are NHS providers, but for the vast majority we are part of the voluntary sector, and so therefore we sit slightly outside of the NHS. And that's really important actually with reference to providing healthcare, because it means that sometimes access to information is really quite difficult because we don't have access to the same systems used in the NHS.
Well, my name's Susan Wilson, and I'm the daughter of Bridget Wilson, who liked to be called Myra Wilson, and she became a patient here in the hospice in November of last year, 11 days before she actually died here. She was diagnosed with terminal lung cancer back in January of 2017, and it was inoperable.
She was experiencing some headaches that may have been referred pain from her primary tumour, but it could have been other causes, and we asked the oncologist if they would be able to organise a head scan.
I knew the results were there, but I couldn't get to them. And I remember saying to Dr. Sam Edward about it, and she said, well, we can get to them right now. I thought, that's great, that's just the sort of immediate stuff that I've been trying to achieve, and there it was.
Ultimately, the pain was very difficult to manage in the home care setting, and we ultimately decided to bring this lady in for an inpatient admission, and indeed it was a terminal care admission. This meant that we managed to avoid having to access any out-of-house services at all. We did not contact a single on-call doctor, we didn't contact 111, we didn't have to use emergency services, and we brought her into the hospice, and I hope we achieved a good death and a good experience, which ultimately I think is really, really important for people at times of crisis.
You can't control the cancer and something that's going to kill somebody, but you can control, with the hospice's help, the route by which you get to the end. And that's what I got. And she had the best possible death in the best possible place.
The benefits to our hospice are, most importantly, patient experience at times of difficulty, followed by efficiencies in decision making in terms of being able to access information that is current and up to date as a healthcare provider. And finally, as a charity, the financial benefits of being able to save time on administration costs means that we're able to put that back into care.
St Joseph's Hospice provides excellent generic care, but with this sharing of information, this collaboration, they're able to provide excellent tailored care, and that takes it to a whole new level. What it is really, it's another tool in the 21st century toolkit. It's something which the hospice has on board, which I know some other hospices have already got on board. All the hospices need to get this on board so you can move forward and make care that much better.